So my name's Nicole Sheers. I am a respiratory physiotherapist by background, and now I'm a senior research fellow at the University of Melbourne and the Institute for Breathing and Sleep. The reason why breathing is such a crucial part of the problems that people with motor neurone disease face is because, your breathing muscles are like any other muscle, and so with MND you get weakness of those muscles. And when that happens, people underbreathe of a night time, they can develop chest infections, it impacts on people's ability to cough and clear their secretions. So respiratory care is a really specialised area in something like MND, which is already a rare disease. So you've got this kind of overlapping diagram of a specialty within a specialty. People who have good multidisciplinary teams where they've got a lot of skills in respiratory management, whether that be a respiratory and sleep physician or a respiratory physiotherapist or a respiratory nurse, those people with MND, typically they're receiving kind of the excellent level of care. But what we know is not everybody with MND around Australia has access to that level of support and that level of expertise. I've been really lucky that I've just received a FightMND Care Support Grant to do some online modules, run some workshops and set up a community of practice to look at how we can improve the knowledge of our healthcare workforce around respiratory care in motor neurone disease. What we're hoping to do with the workshops and the online modules and the community of practice is really try and upskill the wider community so that they can take their existing skills and their existing knowledge and just put a bit of an MND spin on that. So the idea is that we'll work with each of these communities, find out in that state what's the kind of workshop that they would like to have developed, and then we'll be running those around the country with the local networks that we've already got. What I envisage is that these workshops, the community of practice, the online modules, will really be able to lift that level of base knowledge so that healthcare professionals in the community who are working with somebody with MND, they can either upskill to provide a better standard of care, or they'll also know what they don't know and therefore who to reach out to ask for help from. So I think for me, in 5 to 10 years' time, we will have a workforce and a broader community that's got more awareness of respiratory issues and how to treat them and what therapies are actually available to help improve breathing symptoms, quality of life for somebody living with MND now.